May I invite the first group to join the stage with such an interesting topic about telemedicine for dry eye disease, a sustainable healthcare innovation for early detection and treatment, presented by Pitchsinee Oimpitiwong from Phramongkutklao College of Medicine.
Good afternoon, everyone. My name is Pitchsinee Oimpitiwong, a third-year medical student from Phramongkutklao College of Medicine. Today, I would like to present the research named Telemedicine for Dry Eye Disease, a sustainable healthcare innovation for early detection and treatment. Starting with the background, dry eye disease is a growing problem. Globally, systematic dry eye disease affects 11.6%. However, among Thai smartphone users, the prevalence is dramatically higher, 85.8%. This is driven by the digital lifestyle, causing eye strain from tear imbalance and fatigue. These conditions also affect patients' mental health and daily performance. The increasing prevalence of dry eye disease in the digital era generates three major downstream problems. First, reduced quality of life and productivity. Second, poor follow-up, poor compliance, and limited self-management. And third, the OPD overcrowding and limited access to ophthalmic care. From these leads us to our core research question. But how can we bridge the gap in eye care access and follow-up? So the answer is telemedicine for dry eye disease. Our model contains 4 strategies. First, the online screening with OSDI and DEQS to efficiently identify cases. Second, the remote symptom monitoring to track patients' data without frequent visits. And third, real-time patient education to ensure instant self-care guidance. And fourth, the personalized feedback and follow-up tailored to individual patient data. We have 3 primary objectives. First, to evaluate telemedicine effectiveness, which is one of the most important reasons for using telemedicine. And here we use to identify behavioral and treatment-related factors associated with symptomatic changes. And third, to assess patient satisfaction and feasibility, ensuring the innovation is acceptable and practical for both the patients and the healthcare system. Our methodology, we enroll 96 participants with the patients aged 20 to 60 years from the eye department from the Phramongkutklao Hospital. And the design is a cross-sectional study with a prospective 1-month follow-up. The data collection we use baseline and 1-month assessments along with tools with telemedicine. Tools with telemedicine are composed of 3 tools. First, Ocular Surface Disease Index or OSDI, Dry Eye Related Quality of Life Score or DEQS, Telemedicine Satisfaction Questionnaire or TSQ. For analysis, we use parity test for p-post comparison and multiple linear regression for associated factors. From our result, the sex distribution of participants demonstrates the majority of females, which is 71 and 25 males, accounted for 73.96% and 26.04% respectively. The age distribution of participants reveals the mean age of 49.40 years. Over half, 50.6%, are in the age of 60 to 65 years. From this is our highlights from the linear regression also provides the critical insights of first, non-compliance is associated with significantly worse outcomes with a coefficient of 6.99. And the compliance is strong predictor of SDI reduction with a coefficient of 8.26. Crucially, the number of eye breaks per hour emerges as the strongest predictor of improvement with a coefficient of 6.11. And these are all factors associated with the lower OSDI. Clinical outcomes or OSDI assessment also shows the significant reduction in mean OSDI scores decreased from 32.29 to 22.70, which represents a reduction of 29.7%. Similarly, the DEQS assessment also demonstrates the significant improvement in the EQS scores, substantially decreased from 13.97 to 4.16, which is a remarkable reduction of 70.2%. The patient satisfaction from the TSQ assessment also represents the high overall satisfaction of mean TSQ score with 3.61 out of 4. This translates into the strong intention for the future telemedicine use of 92.9% of participants. From this is our discussion. Telemedicine intervention leads to clinical improvement with significant reduction in OSDI and DEQS scores, meaning better symptoms and quality of life. Another one is behavioral adherence with consistent use of 20/20 rule and public care also proves the strongest determinant of improvement, improving greater symptom reduction and leading to better treatment effectiveness. Focusing on behavior, frequent eye breaks also shows the highest measurable impact with the more number of breaks per hour also leads to 6.11 point OSDI reduction. More importantly, the artificial tear compliance also illustrates the meaningful symptom improvement, where the regular use also proves the better lubrication and ocular surface comfort. The high satisfaction also shows the strong acceptability of telemedicine, with the positive TSQ feedback also shows the readiness for long-term remote follow-up, and teleconsultation also reduce access barriers, improve care continuity. The clinical effectiveness of telemedicine in dry eye management is supporting number 3, SDG, good health and well-being. Early detection, personalized follow-up, and patient education also supports number 9, or industry innovation and infrastructure. And overall of the sustainable patient-centered model for long-term DED management also show the reduced inequality of SDG 10. And these are 4 take-home messages of first, structured telemedicine as an effective model for dry eye management. Second, behavior-driven improvement through frequent eye breaks and consistent care. Third, high perceived value due to convenience, guidance, and real-time support. And fourth, telemedicine as a scalable and equitable pathway for accessible eye care. Thank you for your attention.
Such an interesting topic. Do you have any questions or comments, judges?
Thank you for the very good presentation. I just wonder, why you choosing the dry eye for the telemedicine, and how frequency does you follow up with a patient, and is it any different from coming to the inpatient?
Okay, thank you for the question. I would like to answer the first question of why I'm choosing the dry eye disease for using telemedicine, because it is suitable for non-urgent or non-clinical ill patients like dry eye disease, because the symptoms are quite more like the chronic diseases, which would very important to use the supportive treatment like the artificial lubricants used. And also from this, the frequent of the number of follow-up is starting with 1 month follow-up, but I also have a plan to make it in a frequent number of follow-up, like 3 months and 6 months, and also 1 year or 1.5 in the further implementation. Yes, because most of coming to the hospitals are required for the use of the physical instruments at the OPD. So using telemedicine is like working or detecting the patients from the online with the 3 reliable tools from the tear film and ocular surface society, which is a reliable tool for patients to detect from online and not using the physical instruments.
May I ask, do you have any indication or recommendation for the patient that need to come in for eye examination?
Yes, our study is required for the first time that the patients have to come to the hospital to examine with the physical instruments that he or she is dealing with the eye disease. But this one is for the follow-up, or the one another important things that make the patients come to the hospital is some of the red flags, like you have visual loss or flashes of light, or you have curtain or shadow in the visual field. That one might be very important to like immediately go to the hospital.
The 2020 rules show that have a significant benefit, right?
Yes, from many reports and also from our patients that I have interviewed with, the 2020 rule is quite easily to remember and can be used in our daily lives. Like the first 20 is every 20 minutes you have to like look the further things for like at least 20 feet away and at least for 20 seconds. Okay. And from many reports and from the interviewing from the patients also say that like when some of the occupational activities cannot be raise their eyes for so long, so this 2020 rule will compliance with their daily activities more.
So my question is, how did you measure the adherence to this rule? So I have been given this rule for some time that you have to do this, but I'm not a good patient, so I'm not follow these rules. So how do you measure that your patient follow these rules? So the patient to do this, and how do you measure that they do as you order?
By asking the factors of this are involved in the part of the number of eye breaks per hour. This is examined by the linear regression of the patients, like the number of how they like compliance with these behaviors, how much they did it.
Maybe today I'm a good patient. I do that frequently, but yesterday I'm
didn't
a
do.
lazy patient, so I'm not do that. So how do in 1 month how do you calculate this rule that the patient follow this rule?
Asking the average and also see like the average in a week, in each week.
So do you calculate that, or you ask patient to average that? In your study?
Ask the information from the patients.